Good morning. So today's topic is about root canal sealers. So by definition, root canal sealers are used in conjunction with biologically acceptable semi-solid or solid obturating materials to establish an adequate seal of the root canal system. So basically, root canal sealers are a component of an obturating system which comprises of gutta and a sealing agent. So sealers are the binding agents used to fill up the gap between the root canal walls and the obturating materials. They also flow into the irregularities, discrepancies, the lateral canals, and other complexities of the root canal system, which the uh, gutta cannot propagate. So the ideal root canal sealer should form a hermetic seal. It should provide good adhesion between itself and the canal walls and the obturating material, which in case is gutta. It should be radio opaque enough for future radiographic investigations. Should not stain the tooth structure. It should be dimensionally stable. It should be easy to manipulate and introduce and coat the walls of the canals. It should be easy to remove if necessary, be insoluble in tissue fluids. It should be bactericidal or at least bacteriostatic. It should be non-irritating to the periradicular tissues and should set slowly to provide enough working time for the operator. So what does a sealer generally do? It acts as an antimicrobial agent. It binds the root canal walls and the root canal obturating material. It acts as a filler, as a lubricant, and provides radio opacity, and as a also acts as a canal obturating material. So broadly, root canal sealers can be classified as zinc oxide eugenol based sealers, calcium hydroxide based sealers, glass ionomer based sealers, and resin based sealers. The examples of each are given below. So these are the commercially available different systems of root canal sealers. So we'll first see about zinc oxide eugenol based sealers. So the most common sealers used is zinc oxide based, and the base ingredient will be zinc oxide. They usually contains eugenol either or in combination with other liquids to improve the handling characteristics of the sealer. And Grossman's non-staining cement was developed to meet most of his criteria for an ideal root canal sealer. So the powder component comprises of 42% of zinc oxide, 27% of stabile resin, 15% of bismuth subcarbonate, 15% of barium sulfate for the radio opacity, and 1% of sodium borate and anhydrous. The liquid component is usually the eugenol. So it has a setting time of 2 hours. It sits in root canal within 10 to 30 minutes due to the moisture of the dentin. The quality of the zinc oxide and the pH influence the setting reaction of the cement, and the plasticity and the low setting time is the most ideal characteristic for this cement. That is why it is being used universally. It has a good sealing potential and small volumetric change on setting. The root canal cement is mixed on a sterile glass slab with spatula. 2 to 3 drops of liquid is usually used, and slowly small increments of cement powder is added to the liquid, and it is manipulated to a smooth, creamy consistency. So the consistency is tested by raising the spatula from the slab and checking out for a string which lasts for at least 1 inch long. And the correct consistency is identified by a good coat on the GP cone. The thicker the sealer, there will be more heterogeneous appearance and they will be granular in nature. And a thin coat will not be tacky and it will be too flowy so that the cement will drip off from the gutta cone. So the correct consistency, the ideal consistency, the gutta cone will be evenly coated and it will not be in dripping consistency. So the next is calcium hydroxide based sealers. So the use of calcium hydroxide base as a root canal filling material is based on the assumption that there is a formation or hard structures or tissues at the periapical foramen. So the advantages of calcium hydroxide based sealer are it can induce mineralization, induce apical closure via cementogenesis, inhibit root resorption subsequent to trauma, inhibit osteoclastic activity via an alkaline pH, seal or prevent leakage as good as or better than ZOE sealers. And it is generally less toxic than zinc oxide eugenol sealers. So this Celopex by Care Company is a non-eugenol calcium hydroxide polymeric resin root canal sealer. It is available as two paste system. So the base paste consists of zinc oxide with calcium hydroxide, butylene, benzylene, and sulfonamide, and the catalyst contains barium sulfate, titanium dioxide, your radiopacifiers, isobutyl salicylate, acrylyl al 7972, and zinc stearate. So the calcium hydroxide based sealers was found to be better compared to other resin based sealers in many of the literature studies. So next we move on to the glass ionomer based sealers. So it is advocated as a root canal sealer due to their ability to bind with dentin. Basically, the polycarboxylate chain chelates with the calcium ions in the root canal walls and they form a chemical bond. So the commercially available glass ionomer based sealers are Ketoc Endo by 3M ESPE. They're not popular as they are difficult to remove during retreatment. The only disadvantage of a glass ionomer based sealant is that it seals better and it has a good bonding to the dentin. Only during retreatment where the sealer and the GP has to be removed due to any post treatment disease, the retrievability of glass ionomer based sealers are little tough. And at last, we move on to the resin-based sealers. So the one trademark is the AH26 by Densefly. It is an epoxy resin containing non-toxic sealer. It the radio opacity is imparted by bismuth oxide as in for all the sealers. It has good adhesive properties. Contracts slightly while hardening. The only thing is the dimensionally stability is little bit lower than compared to other sealers. So the same brand came up with another advanced sealer called AH26. So there was comparison between AH26 versus AH plus, and AH26 was found to release formaldehyde during setting, and AH plus is a modified formulation of AH26 so that it doesn't release formaldehyde. Since formaldehyde was found to be a known carcinogen, the advancement was done. So the advantages of AH plus is it has a good sealing capability. It is biocompatible to the periapical tissue since there is no generation of formaldehyde, and it's moderately antimicrobial. And dentinal addition is good. A long working time and ease of manipulation is being seen in this AH plus. So to conclude, no root canal sealing material is entirely innocuous, and any exclusion reduces the chance of healing by as much by 25%. Zinc oxide eugenol cements are uh, known to be irritant due to the presence of the eugenol oil. Then epoxy resin sealers are more biocompatible. Irritation caused by overfilling is fortunately generally mild for the most of the materials. So the ideal way to coat the sealer or apply the sealer in the root canal system is to confine it within the root canal system and not to extrude. Be it any form of sealer, it is best to confine the sealer within the root canal system. Thank you.